Good morning. Chris Ohl, Infectious Diseases, Wake Forest Baptist Health. Last Thursday in January. We made it through January. Yay. So that's a big hurdle, actually, because a lot of us had predicted that January would be our toughest month. And in retrospect, not quite as tough as I thought it was going to be, but still formidable. Across the country, there's still a lot of COVID out there, but we've had roughly about a 35% decline in the number of cases. It's kind of interesting how the waves go with COVID. So if you remember back in early December, right after Thanksgiving time, the Midwest was getting slammed, particularly the upper Midwest. And now they're a lot quieter compared to some places in the Southwest and the Southeast. So here in North Carolina, we've seen a decline in our numbers too. Slow but sure, going the right way. And that includes just about every county has had a decrease. Some are decreasing faster than others. Forsyth and Guilford County, as of this morning, had case rates of 52, and if roughly around just before Christmas, we were in the high 70s. So that's progress. And I think that, sort of the late January, people are a little tired of the holiday socialization, maybe taking some time off, spending more time at home, watching more Netflix, and that's helped. But we need to make sure we continue to wear our masks and to personally distance and to really avoid the family and friend bubble fusions, as I call them. I still hear a lot of people who get, phone calls, oh, we're quarantining, and because there was a case here or a case there, and so it's still happening and will for some time. The deaths kind of have plateaued across the U.S., and deaths lag usually by a couple weeks, case rates. So I would anticipate that deaths will be coming down as we get into February. So what do I predict for February? Well, it's going to depend on us if we continue to wear masks, personally distance, and avoid the bubble fusions, and lots of good hand hygiene. The rates should continue to slowly come down, but if people start getting social again, we could have it come back in another wave. So I think it's going to kind of undulate a little bit, up and down, but hopefully mostly in a downtrend. We can't relax though yet. Still a lot in the news about, quote, variants, and there's three that's following. We talked about variants last week, and so I won't go into the science again. But between now and last week, really not a lot more known about these variants. The ones that people are most worried about are the ones that popped up in South Africa and in Brazil. Some people are concerned that the one in Brazil might actually evade natural immunity. So if you had COVID once before, that you could get this variant. That's not really been proven yet, and we need to get more science to know that. You can be concerned about it, but until you know it for sure, you'll have to just kind of take it as it comes. These variants actually are the same things we do for regular COVID. Will help keep us safe from variants as well, and that the masking and the distancing and avoiding the close contacts with other people. Our tools are the same. So it's what are we going to do different? Some people say everyone should be wearing N95 masks, which are the special masks that we wear in healthcare. Actually, when we're taking care of COVID patients, a lot of people still use surgical masks. don't wear N95s, and we really haven't had many issues. So I'm not so sure that wearing N95s around everywhere is any better. For average people. And the masks are more fatiguing after you've had it on for a while. And so I'm a little bit concerned that if people think they're supposed to be wearing N95s, they may be spending more time with it hanging around their neck because it's kind of uncomfortable. So for now, I'm sticking with my cloth mask. And it should work just as well for the variants. Remember, though, we talked a lot about masks, cloth masks, way back early part of the summer, and that they're not all the same, and you want one that's at least got a double fabric and maybe some filler with it. The gaiters that stretch when you pull them up don't work as well. Thin fabric doesn't work as well as the thicker fabric. So when you choose a mask, choose wisely. So a little bit about vaccine. About 7% of the U.S. population's been vaccinated. So we got a ways to go. This has been, if you remember as a kid playing that game of red light, green light, that's kind of how I've felt with the whole vaccination thing. So you get your vaccine in, and then all of a sudden it's green light, vaccinate, 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 and then all of a sudden, whoops, no vaccine for you this week, red light. And then all of a sudden, here's your vaccine again, and it comes in they let you know with like 24 hours notice, and then it's green light, and off you go vaccinating again. So, if you, the public, thinks that it feels kind of jerky, it is, and it just has to do with how the vaccine comes down from the federal government to the state, and then how the state distributes it. As time goes on, that's gonna even itself out, I think in the next 3 weeks it'll even itself out, so that it won't seem so jerky. But there's for quite some time, there's going to be more people who want to get vaccinated than there is vaccine available. And that's just the way it is. The factories are trying to ramp up their production to make it faster. We'll have, I think that AstraZeneca's vaccine probably won't get looked at by the FDA maybe until April. Johnson & Johnson has an adenovirus vectored vaccine that might be going to the FDA as soon as next week, maybe this weekend. It's a little unclear how good it is because the company hasn't really released any preliminary data on it. So when the FDA looks at it, I'll see the data, and then I'll let you all know how well the Johnson & Johnson vaccine will work. The one thing about that vaccine is that there's not very much of it that's already been produced, and it's a little hard to make, so there won't be a big supply of it initially. So I think for most of us, we'll be using Pfizer and Moderna, the two messenger RNA vaccines. Here in the Triad area, the county health department now has a mass vaccination site set up at the fairgrounds in the education building there. And I was talking to Glenda Dancy, who's one of the people heading that up over at the health department yesterday, and it's going really well, actually. And they hope to be, within a couple more weeks, maybe doing 4,000 to 5,000 vaccines a day, and that's a reasonable amount. Of course, we'll have to have them coming in from the state, and we don't have that amount yet, but from a vaccine. But when we do, we'll have the engine to get people vaccinated. There's a partnership between Forsyth County Public Health and Wake Forest Baptist Health and Novant Health, and working together at that facility. This is really an example of there is definitely an economy of scale with vaccinating for COVID. And so when you get a lot of people together, working together in close partnership, sharing vaccine, one person doesn't get very much, share it that way. If the other person doesn't get very much, share it this way, so we can all work together for the better health of the community. So I'm really encouraged by that, and I think it'll help get people vaccinated. Mass vaccinations, so like you might see in a stadium or something like that. I think there's one going on in Charlotte this weekend. I think after that, you might not see those for a while until we can have enough vaccine to support those. And because if you put all your vaccine into these mass vaccination sites, it means a lot of other people might go without it. And so we're trying to be very equitable about vaccine distribution, urban versus rural, and then particularly our historically marginalized populations. And I'll tell you, that's one area where we got to work harder, because the socioeconomically disadvantaged, and then for people of color and other ethnicities, are not getting vaccinated at the rate they should be. And we've been talking about how best to reach out to these communities. There is some vaccine hesitancy in these communities. So we need to educate and communicate, reassure, and then provide access to vaccine. And that's the goals as we move forward. So a couple things about the vaccines. Still, the messenger RNA vaccines, after the second dose, people sometimes will get a little bit of a fever. And you will be sore, and that's normal. I call them, rather than call them adverse reactions or side effects, I just call it an expected effect. And it just means the vaccine's working and your immune system's revving up. If you take some ibuprofen or acetaminophen, which is Motrin or Tylenol, the night after getting the vaccine, the night before you go to bed, then that helps mitigate the fever and doesn't interfere in the vaccine response. There's been some urban myths going around about the vaccines. One is that it'll make women infertile. That is not true. Not even close to being true. It's just a big falsehood. I mean, the vaccines wouldn't, there's not even biologic plausibility for that. And the WHO said that people who are pregnant should avoid Moderna vaccine. I'm not exactly sure why they would say that, because yes, there was no pregnant women in the clinical trial, but there were no pregnant women in Pfizer's clinical trial either. So why separate out just the Moderna vaccine? I don't know. And those two vaccines are so similar to each other. And when you look at the way the vaccine works and how it works, the safety in pregnancy would be very assured. And we've vaccinated a fair number of pregnant women so far. We keep them in a registry. So even if a pregnant woman gets the vaccine, we take the info and submit it. And that registry hasn't shown any safety signals or problems at all. So American College of Obstetrics and Gynecology recommends that that women who are pregnant talk with their doctor about getting vaccinated, and is advocating vaccination in that group. And it's because pregnant women have more complications if they get COVID. So it's a good reason to get vaccinated. So I guess I'll go ahead and, there was a question that was submitted last week that I didn't get to about the recent reports on wearing two masks or a type of mask. I think that if you have a good mask, like I was talking about before, that has at least 2 layers and a bit of a filler in it, it's probably sufficient. and I see people wearing 2 masks, and you can if you want. There's no real studies that show us that it's going to be any more protective for you. Remember, a lot of the reason for the mask is to protect the people around you. Just in case people wonder, everyone here is back at least 12 feet from me. So, but it's I don't know. It's kind of personal preference, I think. I don't feel a strong need to do it. So, with that, I'll open it up to questions.
Yeah, I guess we'll start with a lot of people you mentioned getting their first dose of vaccine and not entirely sure when there's going to be vaccine available for their second dose. We've gotten some questions about, what happens if I'm late on getting my second dose by a week? Can I push it back months? I mean, what's going to happen if I'm a month late getting my second dose?
Yes, regarding the second dose and whether or not there'll be enough around, so far, the federal government so here's how we do this. We have all of the first doses. Each vaccine provider counts all their first doses, and then on the day, so we do it by week. And then the program that distributes the vaccine automatically counts the second dose in for either 3 weeks or 4 weeks, depending which vaccine it is down the road. And then it sends you that number of doses. And so far, that part's actually been working pretty well. So we haven't had any issues with getting the second dose. And the federal government says that they're going to continue to do it that way. So I'm not too concerned. Now, if you don't get the second dose for some reason, then the data shows, so let's just take Pfizer, for instance, Pfizer's vaccine. It's 21 days. So the data shows that if you wait up to day 42, we have data that shows that it's probably just as good. Beyond 42 days, we don't really know for sure. The ACIP's guidance is that for some reason, if you miss the second dose, you just get the second dose when you come to get it, and we don't have to restart the vaccine over again. So we try to keep it down to the day that was in the study, 21 days or 28 days. I think a couple, 3, 4 more weeks afterwards is not a problem at all. And the CDC just came out this week saying you have up to 42 days from the time you get the vaccine. So I think it's fine.
Awesome. And then you talked about marginalized communities and getting that out there. And the rate right now within the state is a little lower with minority communities than the population says it ought to be. Do you think that's a problem with education or getting the vaccine to them? Where did that lie? It's a little,
yeah. So why are the marginalized communities' rates of vaccination lower? So yeah, some of it's education, trying to get through vaccine hesitancy. I've talked to a lot of groups, almost like in focus group type situations, and they just want more info. The most common response I hear is, "Yeah, I'll probably get it. I'm just going to wait a little bit." And so that's I guess that's a bit of human nature. But access is another thing, because it's if you don't have transportation, it's harder to get to a clinic. A lot of the stuff's now drive-through rather than walk-in, and so you have to make sure that all of those things that are there. So I think you're going to see a lot more working through churches and through other community organizations in these areas, making sure we have material available in other languages, not just English. This isn't different than anything else we've done in public health. It's these marginalized populations are the areas that we always have to work harder in public health, no matter what it is. Measles, TB, prenatal care. It was expected that we would struggle a little bit in that area. So we're going to work hard to try to keep those groups involved.
Awesome. And I know you mentioned earlier that contact tracing isn't exactly as strong as it was probably early on in this battle.
Yeah, so contact tracing, well, when we got into, just after Christmas, when we had so many cases in the middle of the, quote, surge, most of the county health departments backed off, and we're doing contact tracing more for people who were older than 55, 50 or 55, I forget the exact number, or what other medical conditions. And otherwise, for younger people, we're just letting the case person tell their contacts. It's just simply there weren't enough people to do all of it. So now the county health departments are going, gangbusters on vaccines. Yeah, there's not as much contact tracing, which is unfortunate. And I see things sometimes where there's contact, a little bit of errors in quarantine. So, for instance, if you're a contact of a contact, you don't need to quarantine. And that mistake sometimes happens. And quarantine's gotten a little bit more complicated because you could either do 14 days, 10 days, or 7 days with the test on day 5, and it depends a little bit. So, for instance, school systems have one algorithm for doing their quarantine and advising. Colleges have another. Certain workplaces may have their own. So it's gotten a little bit, rather than the county health department doing it all, other people are stepping in to fill in on that.
Everything? Yep. I guess I got one more for you. With thinking ahead to seeing the kind of, we talked about the holiday gatherings. Super Bowl is normally a time you see a lot of people get together. So are you expecting anything to come from that kind of first week in February? And then on top of that, is it safe for people who have gotten their first round of vaccination to all mingle together now, or do they still need to?
So that's a good question. If you've been vaccinated, is it safe to have your Super Bowl party? I'll paraphrase it. And do I expect to see more cases arising out of the Super Bowl? So our behavior should not be changing because of vaccination, and that's a really, really important concept. We still have to mask, we still have to distance, we still have to avoid our bubble fusions. And the reason why is that it is theoretically possible that, like other viruses, you could become colonized with COVID. It doesn't cause disease in you because you've been vaccinated, but it's possible you could give it to somebody else. So until we know more about that, and until our case rates come down enough, we still have to keep doing these safety measures. If you think about it, if you get, I guess we can compare it to a football game. If you got a running back and he's headed for the goal line, if he gets hit by 2 defenders, he's much more likely to go down if he's only hit by 1. So the more measures we can take to slow the virus transmission, the faster that transmission will be slowed. And so we got to keep doing it. So is it safe to have a Super Bowl party? No, it's really not. Not unless you're having it with your own household or with your own little pod of people who you're around a lot. And I'm not saying that just because I'm a Green Bay Packers fan. I think this year it's time to watch the game, text with your friends, or put on a Zoom call on the side for all of that fun commentary. You can still eat lots of food that's not healthy for you. That doesn't go away. So you can, but people should not be getting together for the Super Bowl. It's just not a good idea. Now, if you're going to do it outside and stay masked, you can, but a lot of people this time of year in particular, I think, would find that hard. Very good. Well, I'll see everyone next week, and hopefully we'll have more good news.